Now, former President John Mahama has accused government of crippling the National Health Insurance Scheme with the introduction of the cupping and realignment of the fund. This, according to the former president, has reduced sources of funding and it's affecting the quality of healthcare services. At a meeting with members of the Ghana Medical Association, the NDC flag bearer assured of his commitment to improve health financing and revive the struggling scheme should the party return to power in 2021. He's also been pledging to operationalize abandoned health facilities, including the one at the University of Ghana campus.
Resources have become insufficient to sustain the health insurance, and so looking at new sources of funding for health insurance will be important. Abandoned health projects all over the country, we discussed it, and we made a commitment that when grace smiles on us, we will aggressively complete those abandoned health projects so that our people can have better access to health care. We talked about operationalizing projects that have been completed but are standing idle, like the University of Ghana Medical Center, the Bank Hospital, and several other projects that have been commissioned, Upper West Regional Hospital, but are still not operational. Modernizing the Tema General Hospital so that we improve access in the Tema area, and many other places, Kumawu, Bekwai, Fomena, Tepa, Salaga, and all of them. We also believe that there should be an equitable distribution of medical personnel across the length and breadth of this country so that people have access to quality health care. There are places in the country where the doctor or health personnel to patient ratio is very abysmal, and so depending on which part of the country you are, you probably be deprived of quality health care because we do not have adequate personnel in that place. And of course, there's the issue of incentivizing people to go to underserved areas. It's one of the issues that we talked about. We talked about creating a paperless system, folder system in all our hospitals that should be based on local content, that Ghanaian IT specialists should develop a system that we can put in the hospital so that you don't need to carry folders to consulting room and all that. And I think that is a challenge that we can take. We started something like that in Kolibu, but we're not able to complete before we left. And so it's something that we can look at. We talked about expanding private medical care. The government alone cannot provide universal health care to all Ghanaians, and so the private sector has a role to play. So how do we incentivize and help the private sector to also play their part in terms of health for all under the SDG number 3 goal? We spoke about having a new, more efficient medical procurement system to replace the colonial central medical stores and regional medical stores, a system that will bring in medical equipment and drugs at a cheaper and more affordable rate than the current inefficient system we have. And then also, finally, we discussed the issue of expanding comprehensively emergency and trauma care, so that whichever part of the country you are, in the event of any emergency or any trauma, you can have quick access to care so that it will save lives and also improve the quality of health care of accident victims and other such people.
Former President John Mahama, also flag bearer for the opposition NDC.